out and to build some software, which we have done. These are some of the people that helped get that done. Now, some of them obviously dress up nicer than others, and some you see we celebrate our culture and our team. We are, again, based here in Nashville. The top left-hand corner, that's our CHIRP mascot. I won't say who is behind the mask there. But we do believe very fervently that we need to both listen to our customers and invest back into the software in order to provide the service that you can go to sleep at night knowing is working behind the scenes. And we've been fortunate to be recognized as one of the fastest growing businesses in Nashville doing so and recognized by our peers. And we have fun doing it, which I hope is the key. One of the things I would love to show you before we get in here is pictures from our fall conference that we put on called HC2. You are more than welcome. We would encourage you to sign up. It's free to you, and it's here in Nashville. It's an opportunity for you and colleagues to get together, as you can see from this picture, and be able to hear from some industry experts on compliance, hot topics, as well as to collaborate with other people in your industry. Really, the table sessions are designed for you to be able to make friends with other compliance officers, share best practice, and hear that you're not alone in this quest to make healthcare a safer place. These are some of the outputs and pictures of that, and we'll be sending you more information. Hope that you'll join us in the fall for that. All right, we're chock full of some information today, and we want to be sure we get to it, as well as allow you to ask questions. Again, enter them in the questions tab along the way, and we'll be sure to address them. We're going to cover 4 areas here. We think it's important to share with you what we learned when we just returned from the Healthcare Compliance Association's Fall Enforcement Conference. It's the 2nd year they've done it. It's a really fabulous conference. For some of you who were there, hopefully you will agree with me that it's, I think, one of the best produced areas to hear directly from the regulators, those who are the speakers. For those of you who are not, we'll share with you what we learned. You can take back and make sure your group is aware of, but also I would encourage you to look at it next year. It's a small conference, about 400 or 500 people, and an opportunity to work and speak directly with the OIG. And I actually, along with Donna Thiel and Julie Walker of our team, had the opportunity to ask the OIG representatives there from the Criminal Enforcement Division some specific questions, which we'll show you. We're going to talk about what the OIG said about exclusions, how there are gaps between state records and federal exclusions, and show you a deep dive of that with our CHIRP product. So with that, you now are able to download our Q3 hot off the press report. It is just been released, and encourage you to click through and do so. We'll be covering it in a little bit more detail when we get to section 4, but this is what we're going to be referencing in a minute. All right. It's important for us to have a good feel just for who is on the other side of this phone call or webinar. So if you will, just let us know with this poll question, which categorically of these industry verticals are you in? It helps us to understand how we can pass information on specific to you and to know the kinds of groups of people that are there. So we'll leave it open for about 2 or 3 more seconds. And excellent. So it looks as if we have hospital is the majority, other, which I'd love to find out what that is, but health plans and long-term care certainly pulling their ranks. Okay. Well, what we're going to talk about applies to all of those verticals. All right, so what did we learn? We were there just about 2 weeks ago in DC up at the Healthcare Enforcement Conference. And again, the speakers were OIG, Department of Justice, and law firms that work directly in this space and area. Here's what we learned. We want to make sure you have those. And I won't cover all of them in detail because you'll have the opportunity to see them, and we're happy to discuss them one-on-one afterwards. But the Department of Justice Fraud Division opened up the conference and showed us how they actually are using PhDs in data analytics that now work for them to find and ferret out the fraud users. And they used an example of a physician and how they took a haystack and found that needle of the physician that had the anomaly of being the highest biller for a particular type of service and or clearly was taking advantage or abusing the system. It was fascinating to see how they really worked through data mining. When they talk about data mining, they're serious about it. They've now employed a whole team of people to go through there. And so when they come to you knocking on your door for an investigation, it's not cold or green to them. They're there because they've pretty much identified what they think they can improve, and that's not the way you want to be receiving an OIG inspector or DOJ inspector to your organization. So they've got these PhDs that are data mining, looking for everything from billing to all kinds of care practices in particular. And this was coupled with the fact that the Department of Justice Criminal Division hired a compliance counsel and a lawyer. Most of the people up there were, but they actually hired a general counsel, if you will, a year ago to assist them, because not only are they doing data mining to find out where they should start, but they're also coming at it with educating their own prosecutors at the DOJ on what is an effective compliance program. We know that there's 7 elements, and for those of you who would like a refresher, we've got both blogs and webinars on our site that we've discussed that. Donna Thiel, who we're honored to have had join our organization over a month ago, is available to review with you those plans or help you in the event that you're unfortunately under a CIA, a corporate integrity agreement. But nonetheless, what's going to happen is the advisor, the general counsel, is going to look at the compliance program that you have documented and see whether or not it meets the minimum 7 elements and is considered effective. Trust me, if they come at it knowing that it's not, or it doesn't exist, or it's just stock words on a piece of paper in a notebook that hasn't been reviewed or updated, you're also starting off really on the wrong foot. They're going to look at that, and they're going to use that to determine if they really need to come and spend some more time in your office. Now, on top of all that, the Department of Justice has been granted a lot of money, and they've used it to build strike forces. They built strike forces in places in which they feel is rampant fraud. And you might be surprised where some of them are. You might not be surprised on others. So clearly, cities like the Metroplex of Dallas and Houston, Florida, Miami in particular, but even Baton Rouge, Louisiana, and others are places where they believe there's a lot of fraud going on, and they've created these strike forces. Strike force is the combination of the Department of Justice, OIG, law enforcement, working together to find and ferret out fraud. Now, you take what they've done in just the last 10 years, they've been successful in charging over 3,000 individuals that they have sought and obtained convictions on, which returned over $10 billion to the Medicaid Trust Fund, or Medicare Trust Fund. When we had a chance to go one-on-one with some of the OIG people, it was fascinating to hear their view of their being the pride that they had in what they're doing. And I know that may sound strange to you, because if you're on the other end of them coming to visit you, you might think that it's too much government interference in your job. But they look at it as they work for the taxpayer, the Medicare Tax Trust Fund, and those dollars were raised by taxes and are to pay for legitimate and non-fraudulent care. And it's their job, and theirs exclusively, the DOJ and OIG, make sure it's not being wasted. So that's one of the reasons they take pride, and they built these strike forces. Now, what you don't want to find out is that you're there because one of your own employees whistle blew and brought a ketan case. That is evidence that you probably didn't have an effective compliance program because they didn't feel comfortable coming to somebody there and self-disclosing it and trying to resolve it as a good citizen, or they did and they fell on deaf ears. But the DOJ loves ketan cases. It's returned billions of dollars and made their life a lot easier. Now, a couple of other things we learned from these regulators, specific to exclusions. They reiterated their guidance that they issued over 4 years ago that exclusions should be conducted monthly. The OIG recommends with guidance, because statutorily they can't force you to do it, but statutorily they have the authority and they enforce penalties for violations. So call it what you want, recommended or required. If you do it you're going to avoid these fines. If you don't, you're going to likely be paying these fines. So that means this is considered low-hanging fruit. And it's pretty easy for the OIG to go after. Doesn't take a lot of time. The data mining makes it easy for them. Exclusions are public record. It's very simple. They talked about bringing subpoenas to organizations that they're concerned about and saying, give me everyone on your payroll for the last 12 months. They just simply bump it up against their own list and come back with who they're going to fine you for those excluded individuals. So it's not complicated, and it's certainly 100% avoidable. The other thing they stressed, we'll talk a little bit more in detail about, was that exclusions can occur and be imposed upon a person or a company or entity. And a lot of this gets kind of, I guess, pushed under the carpet in the past, where people really didn't worry about their third-party vendors. But the OIG is very concerned that what they're seeing is a trend of excluded individuals who know that they can beat the system by then turning around and incorporating, but they're the sole owner or the sole employee or the only person providing the service, so they're hiding under an entity. And the OIG is wising up to that and looking at enrollment documentation in Medicaid or Medicare as to who owns more than 5% of the business and whether that person's excluded. So they're getting smart, and they're looking under the hood, if you will. The Department of Justice said their lawyers indicated that monitoring is an element of a compliance program, and if you're doing it, that at least puts you onto the right foot. Now, a few other things that we learned and about specifically how the OIG views exclusions. I call this 201 because we're going to skip the step of what is an exclusion, assuming you know what that is. Talk a little bit more in detail about the types of people and how deep an exclusion can go. The OIG regulators were very, very open about saying, look, excluded persons can be providing direct care or non-direct care. And non-direct care examples can be administrative, managerial. They talked about a housekeeping person that does cleaning in a room being excluded, and that they were concerned about that because indirectly they were receiving, that employer was receiving federal health care dollars to pay his salary. And therefore, dollars were being funneled to pay for an excluded person's salary. So that includes maintenance, administrative, billing, HR, board of director. They really stressed that if in any way, shape, or form you're using federal health care dollars, it doesn't need to flow to an excluded person. So for those of you, as a reminder, civil monetary penalties are what can be issued by the OIG if you've hired or contracted with an excluded person. They're calculated one of two ways. The easiest is an amount that's claimed on a form for reimbursement, right? A nurse, a doctor, or some procedure that you can identify who performed it and what services you're billing. It's specific to a provider. But for those of you who wondered how they impose and calculate a fine on someone who's not licensed, like a janitor or a biller or someone else, they take the salary and the benefits of that person during the time they were excluded, and they then multiply that times 3 if they're coming to you because you didn't self-disclose. So use the self-disclosure protocol. It's a button on the OIG website. No other state has the ability for you to do so on their state. The OIG is serious about this. They would rather you come to them and self-disclose. By the way, they also will give you the benefit of the doubt by self-disclosing that you had an effective program for monitoring because you went to them. So there are multiple reasons why you want to self-disclose. We have a question from Linda that I'd like to address before we move to our next poll question. Linda asks, what if you check exclusions for a company you have a contract with, but you don't check the principals of that company? Can you still be held accountable for using federal health care to pay that company? That's a great question. So clearly, you need to be searching the company, the entity, to make sure that it is not excluded. The question is going to be, how and to whom do you know owns that business? You probably don't know, nor would you have the ability in the paperwork you've sought to collect who owns that business. If the OIG is going to certainly fine you if you're contracting with the entity and it's excluded. it's a little bit of a deeper dive for them to tie that the individual owner or principals were excluded and that you should have known that. Now, clearly best practice should tell you that as you update your vendor procurement collection of records that you ought to ask who owns 5 or more % of the company. And best practice would be to include them, but not required. So it is a stretch for them to push to you the liability that the principal hiding behind the entity was excluded, but not at all hesitation for them to find you if the entity itself was excluded. So Linda, thanks for that question. All right. Our next polling question, again, kind of lay of the land. How do you perform exclusion monitoring? Is it done in-house? Do you use a third-party vendor, or you're not sure? And that's okay not to be sure, because we don't want to exclude you if you don't know. All puns intended there. Okay. A couple seconds. Good. So about half of you are doing it in-house. About a third are doing it with a third party. And some of you either aren't in that position to know, but let me make sure that for those of you doing it in-house or outsourcing, that you are aware of what you should be doing and what are the data sets and potential gaps so that you can assess that process and its success. All right. Again, we're kind of, we'll skip through this and leave this for you. There are a couple of nuances I want to hit on about exclusions before we deep dive. The OIG cannot agree to an exclusion if under Section 7 of the Social Security Act it was based on a false claim or kickback. They have to wait and work in concurrence with the Department of Justice. So if you find an individual excluded under that and you find yourself with a false claim, it's not going to be resolved as quickly as you may otherwise like. Bullet point 2 is news for some people, but the OIG talked about it. It's permissive authority, meaning not mandatory, but they can choose to exclude an individual if they're in default of a federal student loan. They view that as an obligation of the provider to pay back for the right to be a nurse or a practitioner, and if you can't honor that, then you shouldn't be in healthcare, and you could be excluded for that. So be aware that that's out there. Again, we talked about an individual that's excluded controlling a company. The latter two, almost embarrassed to have to put out there because they're like, duh. But if you fail to grant access to your facility for audit or inspection when the OIG shows up, that can lead to an exclusion of your company. So when they're there, they have the legal authority to come in. Don't close the door on their face. And certainly don't make a false statement on an application, particularly for Medicaid or Medicare enrollment. That is one of the easiest ways to find you excluded. So the practicality of getting excluded is that no federal health care dollar can be made for those services. Again, do not get lulled into the fact that if it's not direct patient care access position, that the OIG isn't going to care. They actually do care, and they will follow the dollar. If the dollar is used in whole or in part for salaries and benefits, then you need to not be doing business with that person while they're in that position. And they were asked specifically, what happens if Mike Rosen's an RN and I get excluded, and I say, okay, well, I'll just drop down to a CNA, but I'm still excluded. That doesn't negate the fact that you shouldn't be doing business with that person. It follows the person. It's not unique to the actual discipline. Okay, so there's your direct patient care access is not the rule. What that may not seem obvious to you is this includes transportation services, people who prepare surgical trays, even your board. So anybody in that line is subject to causing you to have to pay fines. Lastly, the Department of Justice wanted everyone to know that the exclusion civil monetary penalty and fine is sort of the cheapest of what you'll have to pay. You'll also likely then be forced with looking at the fact that it was a false claim, should not have been submitted, because billing while someone's excluded is considered a false claim. Therefore, you were paid and have an overpayment obligation to when you knew that person was excluded to return those monies. If you didn't in 60 days, that's another pot of hot water you can find yourself. And again, the state could then separately come after you if that person was not only excluded, but not licensed at the time. So good practice to do what you're doing. Benefits of self-disclosure, I just want to hit on this before we move to our next section. 8.4 months is considered swift as far as the Department of Justice says. For us, that's slow, but that's as fast as you'll get a resolution if you're involved in not only a exclusion but a false claim. If not, it can be longer, which means this is out there, this is a liability, and this is scrutiny that you're under by regulators for quite some time. All right. What we've done is we've studied through our CHIRP analysis both data in, data out, resources, sources, and fines. And wanted to start by sharing with you, let's look at the last 7 years of enforcement penalties just for exclusions. In the last 7 years, over $32 million in fines have been paid by companies who hired or contracted with an excluded person or company. Those dollars equated to 281 people or companies that were excluded. Clearly, there's more than that are excluded, but those are the ones that the OIG went after or those companies self-disclosed. So the average fine, if you take simply the number of people by that dollar in 7 years, is over $100,000. Now, what's important about that is that these were primarily, almost exclusively, all self-disclosed. So 32 million is really 64 million, because if the OIG comes after you, it's 3 times the number. If you go to them, it's 1.5. That number represents 1.5 times the damages and fines. So keep that in mind when you move through here. Okay, we're going to talk about gaps in reporting. And we have another poll question, which is, which lists for exclusion are you searching? When you're monitoring, are you searching, generically speaking, OIG only? The OIG and possibly your state Medicaid exclusion list, if your state has one. By the way, there are now 39 states that have them. Or the OIG in all available states. So we'll give it about 2 more seconds. And here's how your colleagues are doing. About 1/3 of you are doing OIG only, which clearly is at minimum where you should be starting. I want to show and encourage you that there's some other things you're missing. Another 20% of you are doing that plus your individual state, and 40%, which is best practice, does it all. Let me show you why doing it all those states and OIG is important, and eliminate your risk to 0 by doing so. So why is it, if you felt that the OIG's list of excluded individuals and entities was all you needed to search, that's what they say you need to search, is actually not enough. Let's deep dive now into the total world of exclusion records. As of this past month, the OIG has excluded 65,686 people or companies on their list. When you look at those entities, or those people or entities, based on either a social or a federal tax ID number, clearly over 90% of them are people, and 5% of that number are companies. What's a little hard to discern from that, a little footnote I will say, is that not all of the people that are excluded potentially were acting as an individual. They may have been acting as a corporation or a person acting as a vendor, but using their personal Social Security number, they didn't incorporate to protect themselves. They're still excluded, so you need to search that person. For instance, a doctor or a PRN or something of that nature. Now the states, this is where it may need to open up your view and enhance what you're screening. The states, of which there are 39, have an additional almost 60,000 people or entities that are excluded. 60,000, that's almost the same number as the OIG. Now, some of those are both in the state record and the OIG, but a good number are not, and we're going to show you that, which leaves a gap in your exclusion monitoring. Before I get to that, I think it's helpful to follow the public record. How is it supposed to work? If you ever wondered, we sat down and studied, and I confirmed by talking to some of the OIG criminal enforcement people, this is what's supposed to happen, and how the OIG would find out and then decide to add to their list. So let's say that I am a licensed nurse, or even I'm not licensed, but in this case, I'm a licensed nurse. And I'm here in Tennessee, and I get convicted or I plead guilty to some crime involving either fraud, patient abuse, or substance abuse. Put as a little parentheses that it's for a felony, but come back to that in a minute, okay? So I've now had a problem. The police, I've got arrested, and I got convicted to a felony for substance abuse in Tennessee. What's going to happen? That's going to then get reported to the licensing board, the RN board, and the RN board is going to look at that and say, what are 2 or 3 things? We don't care. We do care, and this is a problem, or this is enough to suspend and revoke my license. And so you need to know the status of that on a monthly basis to make sure that hasn't happened. What then happens is those actions taken by the licensing board and or the resulting Medicaid fraud control unit at the state that also is the one that would be excluding you as a result of that conviction and or license revocation, they have 30 days, according to Performance Standard 8, which we'll show you in a minute, to report that to the OIG. So each of the states, actually 49 of the 50, because I believe North Dakota does not have a fraud control unit, but South Dakota or vice versa does. But nonetheless, all but one state have a Medicaid fraud control unit. That's the group that would exclude at the state level and or terminate you from being able to participate in Medicaid. And they have agreed, in order to receive funding from the government for that agency, to report their actions, all of them, any actions, documents they take, to the OIG. Why? Because the OIG can only determine whether to add them to their list if they hear from the resulting state or Medicaid fraud control unit, other than them taking action among themselves. So what you need to know is if the state licensing board and or Medicaid fraud control unit does not do that, it is likely the OIG will not know about it. But the OIG by statute has to, it's mandatory, include that person if it was for a felony involving fraud, patient abuse, or substance abuse. It's required. They have to. So the minute they do find out about it, however they find out about it, they're going to have to include them on the federal list, the LEIE. If it's a misdemeanor conviction, they have permissive authority. They can choose to or not. And I'm not here to discuss, nor do I actually know, what goes into the mindset of when they choose to permissively or not. But let's assume it was for a felony. Performance Standard 8F shows you that in order for the Medicaid Fraud Control Unit to receive its funding, it has 30 days to produce any of these records up to the OIG. Let's see how they're doing. Well, they're not doing too well. The performance review that the OIG performs of the Medicaid Fraud Control Units over the course of 2015 shows as follows. And we've combined 2 sets of data that I think kind of paint the picture. On the left-hand side is a blue bar, and that represents the number of reported exclusions that came from a state Medicaid fraud control unit. And you can see that the numbers are in the 1,000 to 1,500 range over the course of the years, each year. Now, the bar to the right, the red, if you will, is, and we're not playing political, this is not Democrat, Republican, this is pure data. But the bar to the right is red, and the red represents the total number of OIG LEIE exclusions for that year. So let's take 2014, for example. In 2014, there were 4,004, I believe is the number, exclusions on the OIG list that were added that year. The number that came from the state was around 1,300. So that means a third of what you would expect to see in that 4,000 number, the red bar, should be mirrored from the Medicaid Fraud Control Unit. But they're not always there, and we're going to show you examples. And so what this tells you is you really need to be searching over 5,300 records in that year, right? The 4,000 that were added to the OIG list and the 1,300 that the states had that may or may not ever make their way to the OIG but should. If you're missing the blue bar includes all 39 states. That's your exposure of an additional 1,300 people that you need to know about. Let's talk about some specifics to give you an idea. And we randomly picked some states here, both north, south, et cetera, and out west. Wanted to show how they're doing. And we painted it in a positive rather than a negative. Delaware did a great job, although they only had 28 people they dealt with in that year. They got all but 2 of them to the OIG in 30 days. Massachusetts, the next closest, was almost 60%. Florida, large state with lots of excluded people. Georgia, the same. Arizona, not doing well at all, reporting less than 50% in 30 days. This creates a total gap for you and a risk that you can avoid by simply adding the exclusion lists of the states to your list. Here's Rhode Island. Remember, there were 2 that they didn't. Those 2 took over 100 days to get there. Some of the ones that didn't took 50 to 100, and you can see that a small amount actually did it in the 30-day period. So let's look at CHIRP. For those of you who have not yet downloaded it, please do if you'd like. Otherwise, I'll show on my screen what it looks like. This is for your viewing pleasure, and I want to kind of walk you through what CHIRP is and how we produce it for you in a way that hopefully sells your story. I'm assuming that you're in a position of influence or budgetary request, or you're the one doing this at your organization, and you probably are asked all the time, why are we spending this money? Why do we have people doing this? What's our risk and exposure? Okay. When you look at tab 1, Exclusions Overview, let's start in the middle with the circular chart here. Now, the blue represents the total number of state exclusions. We said it was around 60,000. It's 59,400. The lighter red is SAM, but only SAM records, another federal record, that are healthcare related. So we have taken out all Department of Defense, EPA, any other agency that's not healthcare related, and there are 77,000 healthcare related SAM records. Now, supposedly SAM mirrors that of OIG, so that number should be fairly close to the OIG. It's actually a little bit more, which makes sense because they also get debarments and things from other agencies. But supposedly all 65,690 of the OIG records should be included in this 77. I can't tell you that that's actually the case because SAM is not a very good data set, but that's the way it's supposed to work. All right. When you look at another visual, you're welcome to cut and paste these charts into anything you would like or show to your for budget purposes. Therefore, when you look at the breakdown of OIG records, the 65,000 odd or so many, 95%, 62,720 are people, and these are the number of entity exclusions. SAM, 95% people, 5% companies. State, 95% people, 5% companies. You see a trend here, a little bit more companies in the states than you see in the federal. But you need to be searching at least this blue and that red to be confident that you're getting everything. It's best practice to add SAM, but these two, the left and the right, are the ones you need to be including in your searching. Now, I told you we would give you an example. We actually take what CHIRP does is we take every excluded person by name or entity by name, and we look for it from the states in the OIG. And we find out which ones are not there. Now, we don't know all of the time because states don't do a good job of issuing why they excluded the individual. Was it for a felony or misdemeanor? So 100% of these don't necessarily mean they should be on the OIG, but a good portion of them are. Here's an example. So in the state of New York, and yesterday we had the pleasure of somebody from the New York OMIG on the phone, followed up with her this morning, and she was interested to see that we had figured this out and recognized that the best they can do is exclude, but they can't, make the OIG do their job. Here are here are two people, an example of a person and a company. So this is an individual, Dr. Aaron Goldfein, who is no longer a physician in New York or Michigan. He's actually excluded in both, one in 2014 and one in 2015. If you go to the New York OMIG website and you type in his name, you will find him there. If you go to the OIG website, you will not find him there. And here's a gap of between 5 and 1 year, or 2 and 1 year, in what should have been 30 days from that action to get him on the OIG list. So if you're only searching the OIG, you will not know that Dr. Aaron Goldfein is excluded in New York and Michigan. Same for Buena Vista Pharmacy, excluded for a felony in 2000. 16 years they've had to get that to the OIG or the OIG to figure it out, and it doesn't exist. So if you're searching OIG only, you will miss these two records. Yet they're out there and ones that you should be concerned about. Now, before we get to a couple of questions, there's also a tab in the middle called State Breakdown. For those of you who are worried about your own particular state or want to know anywhere across the country, here are your 39 state lists broken down by clicking into any one of them. Matt, grab what you want. Matt likes Texas today. So here's a breakdown of Texas. Texas's list has 10,534 as of about a week ago. We ran these numbers. Individuals on their list and almost 500 companies. You compare that to how many of those names could we find in SAM. It's less than half, or 10% in the company case. And the same for the OIG. We could only find 4,590 individuals on the OIG list of those that came from the Texas list. Clearly, there are gaps. Florida, no better. It's the same everywhere you go. California, pretty bad. So what you're going to find, and you're welcome to take a look at, is that not all these records are making their way to the state, and therefore you need, for best practice and to sleep at night, to avoid 100% of the fines, you need to be adding these states lists to your exclusion monitoring. Before we go a little bit deeper, I want to get to some of the questions that we have out there. So Eric asks, what about the GSA SAM exclusion list? Hopefully the tab we showed you before gives you the total numbers. We can provide you with more breakdown if you'd like, but we thought that the total numbers here are on this first tab would help you. Again, SAM best practice to add OIG you really need to be doing. Linda asks, how current are the state lists that the exclusion check software, that's one of our products, uses? In other words, I shouldn't have to check my own state if your software checks my current state list. So we update all lists every night. So we're looking to see if an update comes in any of the state or federal lists on a nightly basis. We then scrub it to make sure it goes to be where you can search it, and it's within our data set within 24 hours. So all of these lists are with no longer than 24 hours from when they're posted. All right, good. So we're almost rounding out our CHIRP deep dive. Hope it's helpful for you in understanding how that creates some potential exposure for you. Again, if you haven't downloaded it, here is a link in which you can. It's on our website. You're going to get information as a follow-up that will take you to it, but feel free to move around the country, as they say on Southwest, and see where the exclusions are across the board. Before we open up to other questions, I think it's important, if you get nothing else out of today's session, to know these three things. The OIG's list is not the end-all be-all. It should, by definition, but it's not. And that's because states are not reporting their exclusions up on a timely basis, and that creates a liability for you. It does not contain all available exclusions. It does contain all available exclusions that the OIG knows about, and only those that they can fine you with. So let's make it clear. If you searched the OIG for Aaron Goldfein and he was not there, which he's not, but he was in New York, you have no issue of liability to the OIG. They don't know of him. They should, but you do have an issue with the New York OIG. they will be breathing down your neck if you are employing Dr. Aaron Goldfein based on the fact that he is excluded, and I believe also lost his license. So there are different areas of concern, but still to get the state regulator OIGs off your back and or the OIG, combine them together. Secondly, direct accident patient care is not the standard. It applies across the board, whether the person's licensed or not, janitor or brain surgeon, whether they provide direct care or not. They could be in the billing office and never see a patient. They could be the chairman of the board of director and simply govern the company in an administrative or managerial capacity. The OIG doesn't care. They will fine your organization for any of those scenarios. And lastly, remember to include the vendors that you're doing business with. This actually extends to those doctors you're receiving a referral from. If the doctor is referring a patient to you and ordering services, you need to make sure at the time that they come in that they're not excluded. That is an onerous task because you likely do not have that doctor's social security number. He's not an employee of yours, but he is seeking and going to be involved in payments related to the referral. So find a way to ensure that you're including them, even if you have to search just their name on the OIG. And if it's a common name like John Smith, send him an affidavit for he can attest that John Smith is not him. So those are the three takeaways of everything we've talked about today. I want to encourage you to ask questions. Again, type them into the questions field. What we do here at ProviderTrust is niche focused on providing the best possible software as a service to take your mind at ease and not worry about the monitoring. We do it on a nightly basis on our ProviderTrust service, and that allows you to simply upload your people and your vendors, and we'll let you know when there's a confirmed match. We can also track licenses and certificates. It's flexible. It actually can deep dive all the way down to the unit level of who sees and who's being access to the records, and specifically tying into what we're tracking, the required documents and certificates that you need on the floor. If you're a nursing home in Alabama and dealing with, or in a hospital, you're dealing with ICU versus NICU, it requires different certificates, and we can tell you if they exist or expired, etc. These are our products. We don't have time to go into them. Exclusion Check is a do-it-yourself kit. Somebody referred to it in their question. It allows you to log in and per click submit a name. It tells you by searching all 39 state lists, SAM and OIG, whether that name is at least on the list. Broadly speaking, you don't need a social at that point. If a record comes back, you're going to need to do the verification on your own. But that's a simple way to handle it in-house if you'd like. Passport is a much more robust service. It's a monitoring software as a service, ongoing monitoring. Once you enter them in, we're monitoring them until you take them out or terminate them as a person. And it's a much more advanced product service with product features. Vendor-proof is the same, but for vendors. So for those of you who are doing it in-house and can check the boxes that you're doing all the states in OIG, we're really proud of you. You're ahead of the curve. You're doing the right things. And you should feel confident that you won't be paying fines and that you have at least one of the 7 elements checked off as an effective monitoring program. For those of you who are looking to expand, I think now you know the liability that's out there by not including the state lists. And we're going to take some questions that have come in. So Sherry asks, if an individual or company is excluded in one state but not in our state or by the OIG, would we be penalized by the OIG? Great question. So the OIG can only issue fines for people that are on its list. So if you're on the OIG list, whether it came by the feds, by the OIG, or it was reported to them by the state Medicaid Fraud Control Unit, it doesn't matter where that person's located. If they're on the list, you're going to be fined. And that's a real problem because what we see and never surprises us is, say I get excluded in Tennessee, and I figure I'm going to game the system. I'm moving to Kentucky or Virginia, and I'm going to hightail it there because I know I'm being investigated by my state board, licensing board. I know they're going to revoke my license when they take action, and I know I'm going to get excluded. But I know it's going to take 30 to 90 to 120 days for that to happen. So while I'm still in good standing, but being investigated, I move to Virginia. And I get my license accepted in Virginia, and I'm enrolled in Virginia Medicaid because at that point I'm in good standing. 90 days later, Tennessee takes action on my license, and they exclude me, and they report me to the OIG. If you're not conducting monitoring, and you've employed me now for 90 days on day 91, or that point forward, I am on those lists, and you have that liability, even though you're thinking it was in Tennessee. What relevance does that have? If the OIG picks it up, the OIG will go after you. If you're in Virginia and the excluded person is me and I'm only excluded in Tennessee, there's an argument to be made that you're not using Tennessee Medicaid dollars, therefore you could provide care for that person only in Virginia. Not a position I'd want to find myself in as far as compliance. Knowing that the individual was convicted, particularly of a felony involving patient or substance abuse, but in another state is not, I can't give you legal advice, but it's not probably evidence of a moral and ethically person that you'd want on your workforce. And so it has relevance, and you should not be surprised if they act again, but in your state, and then you come to find out all along they had a history of doing so. So technically, only Tennessee would be going after you if you had that person. If you look at Section 6501 of the Affordable Care Act, it says that if an individual is terminated by any one state Medicaid, and they mean terminated for cause, that would be a felony, then they are to not enroll in any other state. That's what it says. The problem is the states don't talk to each other. And what we'll have to see is who are the ones, which states are going after the offenders, and who is who's pushing that button. Okay. Sherry asks, do we need to check vendors that provide painting, floor installation, lawn care? So this is actually a question that involves your risk tolerance. The easiest answer is follow the healthcare dollar. If you're using Medicare, Medicaid, CHIPS, TRICARE, any federal healthcare dollar, directly or indirectly to pay for that service, technically yes. Remember, it has nothing to do with providing or not providing direct patient access care. The janitor that they used as an example did go into a room and therefore had, quote, access to a patient, but the room was always empty when he went in because it was being cleaned between patients. And they didn't think that was enough to not worry about it. They said, you're still taking federal healthcare dollars and paying his salary. So although probably not the banner case, the OIG is going to make a living out of going after your landscaping and painter, it's a risk tolerance question for you as to either the dollar spend and whether you want to risk it or not on that vendor. Or I can't give you a legal answer other than that. It's a risk tolerance question. Brian, thank you for your question. Brian asks, also as a pharmacy, we're working with many providers across the country. We currently track our employees and our vendors. Do we track doctors, offices, and medical groups as well? So this is an interesting question, right? So let's say that the doctor's practice is who you've contracted with, the actual facility, the practice. You really need to search the practice. If, however, you're searching and doing business with just a doctor in that practice, you need to be checking the doctor, him or herself. So we get asked a lot, and I don't know if this is what you're getting at, but a lot of times we get asked, okay, we're going to choose to include the medical practice because that's who we contract with directly with our pharmacy. And they may have one of 5 doctors in the practice that's involved. Do I need to search all 5 doctors and their nurses and the administrative staff of that facility? The answer would be no, technically. The OIG will go after you if you've done business with the entity that is excluded. or the individual that you're contracting with. But they made it very clear, and I would point your attention to the OIG guidance that was issued 2-3 years ago on exclusions. They actually used as an example, let's say the practice of 5 doctors itself is not excluded, but one of the 5 doctors is. One of the 5 individual doctors is excluded, but his practice is not. You can still do business with the practice, and you can still do business with 4 of the other doctors. But you don't need to be doing business with the one doctor that is excluded. He himself does not blow it for the rest of his partners. And I think that's probably the best answer to your question. Okay, well, we are respectful of your time, and I don't want to go over, but really appreciate all the questions that you've asked. You're really thinking this through deeply. I hope this gives you either a comfort level that what you're doing is best practice and you should be proud of yourself, or that you've got some room to improve, and that's okay. Go ahead and look at that and see what you need to do to make your practice stronger and reduce your risk. We hope you found this helpful. Whether or not you did, please subscribe to our blog. It's free. We have all kinds of helpful information. We blog about twice a week, pretty serious issues, and pretty proud of what we do and hope you find it of interest. And then, of course, webinars or workshops like this today, we take a lot of pride in doing. We do them monthly and hope that you will find them of use and sign up for future ones. If you have any questions, you are more than welcome to reach out. I'll give you my email address. If it's specific to a question that you didn't get to ask, it's MROSEN, mrosen@ProviderTrust.com, or feel free to call any of my great colleagues here if you'd like a demo or to speak specifically about what you're doing. We'd be happy to be that resource for you. Hope everyone goes out and makes it a great rest of the week. Thanks so much for attending today's workshop.